Do you ever have conversations with your patients about if they are interested in stopping? What guidance do you give them
I
there?
always tell my patients, muscle mass will help you either stop the medication or require the minimal amount of a dose, right?
Wow. To hear Dr. Rosias, which is a double board certified obesity specialist who's been an outspoken advocate for GLP-1 medications, actually say something like that's more holistic in nature is freaking awesome, guys. And I think this is a big step in the right direction. I know that a lot of what I'm hearing from my patients, and they come to us because they want more of a natural approach. They want to, with the medication help, they want to eventually wean off. But the general consensus, from my opinion, from what I see from obesity specialists, is obesity is a chronic disease. It's irreversible, requires lifelong medication, right? I completely disagree with that. And it's really awesome to see an obesity specialist as well who is in the trenches working with patients who has the same mindset. And she talks about muscle mass, guys. We train that all the time with our patients. I would say second to fasting and second, so maybe third to fasting. I would say fasting is number one, and decreasing your consumption of processed foods, replacing it with unprocessed. Those are up there at the top. And then a resistance training program to protect muscle mass, guys. That is so crucial, and I'm stoked that she gets that.
The more muscle a patient loses, the less probability that they're going to be able to maintain the weight loss. So many patients, I do present this as an option, right? If at one point you want to venture off the medication, muscle mass and the lifestyle that you adapted around it is what's going to help you maintain it, right?
Bring it.
I do want to make clear that these medications is never going to replace a healthy lifestyle. And that's why I always make a point to say the other 50% is still what the patient does in regards to physical activity and their eating habits, right? Even with the medication, the few times that I've seen patients not lose weight is the patients that are still having a very high caloric dense small meals.
Sure.
Right?
She talks about the calories and the exercise component. And again, remember, standard Western approach is all about energy. Calories in versus calories out, that model. And hopefully you guys know that I actually am not completely on the other side of it. Calories do matter. They just don't matter as much as I think science wants us to believe yet, because the hormones govern that. And I have plenty of other videos getting into that. That's where she's coming from a little bit, saying they have to keep up a good exercise regimen. You got to keep up a good exercise regimen for optimal health, not necessarily for sustaining a healthy weight. You don't need exercise at all to sustain a healthy weight when you can get those hormones fixed.